Once I learned that I could go flat and have a flat closure, I was like, oh, that sounds awesome. That would be perfect.
You were clearly, I want to go flat.
Yes.
Is that what you said?
Mm-hmm.
Or
I just want to go entirely flat.
And what happened when you woke up from surgery?
Yes, they were technically gone. I mean, yeah, but I had wonky scars that didn't match. I had a lot of extra skin under and around my sides. And so it's like, well, I wanted to go flat, but I am obviously not. I felt wrong.
Aesthetic flat closure, or going flat after mastectomy, is becoming increasingly popular here in the United States. The problem is a lot of breast surgeons are offering it and they may not be sufficiently experienced or have the time to do the surgery properly, and patients are waking up disappointed. This year alone, I've done several revision surgeries for this. Now in today's video, my patient Jackie is here to share her journey of what it was like to get aesthetic flat closure the first time round, and then more recently we've done more surgery to improve things for her. So first of all, Jackie, thank you so much for taking time out. I know you're busy.
I'm happy to do it.
Yeah,
I'm happy to do it.
It is very important that you share your journey. Okay, so you had a really unusual circumstance of ending up getting a double mastectomy at a very young age.
Yes.
So can you start at the beginning?
Yeah, when I was 18, I had a severe spinal injury, which resulted in, for me, having a difficulty of carrying, I guess, my breasts and the weight on my spine, especially after I was healed. And, well, a number of difficulties happened with healing and then needing to get another surgery and then a bunch of other stuff. So just removing my breasts was, for me, the preferable option, alongside just, for aesthetic purposes after everything happened. It was not the biggest thing I cared about anymore at that point. And once I learned that I could go flat and have a flat closure, I was like, oh, that sounds awesome. That would be perfect.
So you were studying abroad when this happened, and you had a severe fall, and ended up in hospital for many months.
Yeah, I was in the hospital for about 3 to 4 months.
That was in Scotland, is that right?
Yeah, in Scotland.
Okay, that must have been so awful for you and your family.
Yeah, it was hard. I mean, waking up after like a week and a half, I don't remember anything, and just learning, oh, I'm encased in foam so I don't move.
Right.
That was crazy. Yeah.
So you got over that initial trauma. You came back to the States.
Yes.
And then when was it that you had this discussion about having a double mastectomy?
I started thinking about it maybe a year or so later, so around the end of 2019, beginning of 2020, and I did a little bit of research, maybe 5-6 months of research, and then 2021, I believe, I had the surgery.
Right, and that was to help with the whole recovery.
Yeah. I did the intensive physical therapy for about a year after, and so I didn't particularly want to get another surgery so soon after. And then once I was doing more active physical therapy, I suppose, I just came to the conclusion that it would be easier to heal.
Have both
breasts just to remove everything.
Okay. Now, after you had the mastectomy, were you planning to get reconstruction?
No, not really. When I spoke with my first surgeon about it, I asked if, what she'd be doing if I could keep my nipples or anything, and essentially she just said, no, you'll just go flat, and that's all I can do. And so I was like, well, that's great. I mean, that's kind of what I wanted, but no reconstruction was ever discussed.
Okay, because you didn't want it, right?
No,
just to be clear. You were clearly, I want to go flat.
Yes.
Is that what you said? Or
I just want to go entirely flat.
Okay,
like
so you're very
left.
clear.
Yes.
Okay, so you told them you want to go flat, completely flat, and what happened when you woke up from surgery?
There was a lot, it seemed like there was just a lot more swelling and extra skin that I was like, oh, well, maybe it's just swelling, right? I mean, it's a relatively large surgery. I just thought, after getting all that removed and then having drains in, maybe there was just extra swelling, and maybe the drains were causing a little bit more like loose skin than I expected.
Right.
And then I think maybe about 2 weeks after surgery, I realized, oh, this might actually just be what it looks like now.
Right.
Which was a kick in the face,
Right.
it felt like, to an extent, yeah. And because, I mean, to the extent that, yes, they were technically gone, I mean, yeah, but I had wonky scars that didn't match. I had a lot of extra skin under and around my sides. And so it's like, well, I wanted to go flat, but I am obviously not, you know?
Right.
Like, so that was just hard.
Right. It was more like kind of deformed, right?
Yeah, I mean, I didn't think I cared a whole lot about like the aesthetics until I looked at myself after and I'm like, oh, I mean, there's not caring about aesthetics and then there's realizing something went wrong in what I asked for. Or like, maybe not wrong.
But there was a miscommunication.
Yes,
clearly, right?
I felt wrong to the extent that like I don't like how I look right now, which was quite a shame. So
did you ask the surgeon that did it?
I mean, yes, I did, but I had so few appointments with her in total.
You barely saw them.
Yeah, I did,
Okay.
yeah. I thought I'd have more appointments, but then I just never really got a follow-up after the drains, and I couldn't get another appointment. So it was just a whole uncomfortable situation all around, I think. Yeah. And so that put me off, I guess, looking for any solution for a fair few years. So.
And then what happened after that? Because clearly, at some point, you were like, well, this is it.
Yeah. Once I fully healed and my scars were pretty gone, there was just a lot of skin left, and I was like, oh, well, this sucks. It was wearing a lot of baggy shirts, slouching a little bit more, which, again, didn't really help the back problems, and trying to kind of just ignore it and never go swimming and take off my shirt around anyone. So
that's terrible.
Yeah, it was uncomfortable and hard.
So then, at some point, you decided, I've got to do something about this.
Yeah. I started doing research maybe about a year and a half, 2 years ago about what could be done, I suppose, like plastic surgery-wise. Like, I think I started looking into like liposuction first because I just wasn't sure how to fix it, right?
Right.
And then that wasn't the solution, but then I didn't know what was the solution. And so I started just scouring the internet to see what could be done.
Did you find much out there?
Not a whole ton. I found most of the resources centered around mastectomies associated with cancer and the reconstruction after getting a mastectomy, but then having to get more surgery after more chemotherapy.
Right, like revising things.
Yeah, just after, all the healing was done. And so then I kind of was able to go down the route of like, oh, well, what does it look like to get a revision on the mastectomy surgery? And then I was like, oh, a flat closure is what they're called. Okay, well, that's great. Now I have the title of what they're called. Now I can actually find that.
There's a thing for it.
Yes.
Got it. So do you know something called flat denial? Have you heard of that term?
I don't think so, no.
Okay. So flat denial is really when a patient goes to a surgeon and says, I want the mastectomy but no reconstruction and I want to go flat.
Gotcha.
And that surgeon, instead of really fulfilling the wishes, they'll think, well, I know better. I'm sure she's going to regret this. I'm just going to leave a little tissue so that when she changes her mind and comes to her senses, we can then put an implant in.
Yeah.
That's called flat denial.
Gotcha. I don't like that, but unfortunately, it makes sense.
Right. So it's really not really listening to or respecting the patient's wishes. And I think, because I've treated a lot of patients now at this point, both at the get-go, the mastectomy, you do go flat closure from day one, same surgery, or as a revision. And in fact, this year I've seen a huge uptick in revisions. And I think it's just the time sequence. They've become a bit more popular the last few years, and I'm beginning to see the patients that were not properly dealt with.
Yeah.
And so I think it's not just the trauma of the way waking up and not having what you wanted, the physical aspects, living with the extra tissue around, like you said, not wearing swimsuits and not wearing t-shirts that are tight, wearing baggy clothes to hide things. But it's the idea that they weren't listened to.
Yeah.
And their wishes were just ignored. And I think that is the worst part of it as well, right? Yeah. So you found me.
Yeah.
And we had a detailed discussion.
Yeah,
and
for sure.
Did that help you understand what you'd been through?
Yes, for sure. Especially because just off the bat, the amount of attentiveness you and your team displayed. I was like, oh, well, this is probably what it should have been like at the beginning. But I mean, the first appointment that we had, I think it was like an hour or something. Like we were,
an hour and a half.
we were just going through and like looking at pictures of what was possible with different body types, and then looking at, you know, my anatomy and saying, oh, what would we have to do? And then you were telling me like, oh, like we might have to go further around the side, but
and to the back sometimes.
And then you might have to get some like occupational therapy to help you get some movement back. And I was like, oh, well, that would have been great to know the first time, but like it was just such a relief to know that it was being taken seriously, and that there was more long-term planning ahead so that I could have, you know, so that I could heal both well, but also have the mobility that I wanted to going forward.
And that's really important, because aesthetic flat closure, in my mind, you know, consists of several things. Number one, that you are flat, that there's no extra tissue on both sides. The scars are matching, what we call symmetry. And the important thing that a lot of people forget is that you can move your arm. You know, remember I said to you, listen, people come and they're like, I want to be so flat, you know, but you, not at the expense of not moving your arm. You know? So we always have both the arms prepped in, so that during surgery, before we commit to the incisions, we make sure the arms can fully extend up.
Because I didn't realize how loose my chest wall was until I got this revision surgery done, and I was like, oh, well, that's what it's supposed to feel like. I get why I have to do occupational therapy now. And tell me how the whole surgery, how you felt with that surgery. We did put blocks in your case. And you're someone that's had a lot of pain. But I mean, it was super helpful. Both prior to the surgery, like just in the hospital doing like the prep work and stuff, that was great, just getting to see how your team kind of functioned and how smooth everything was. And then, you know, waking up afterwards.
Thanksgiving Day,
getting to see getting to see how it looked with all the nurses and stuff helping me telling me how to, you know, put on the compression band, and then how to watch the drains and how to bandage the drains, and then how to, you know, remove the stuff from the tube so that it's the right amount of milliliters to jot down. That was good, but the pain wasn't too bad, especially as long as the blocks were working, and then being able to get in touch with both you and, you know, your nurses afterwards, just to see if like you needed any more opioids, just to get some sleep at night as I transitioned to just acetaminophen after, you know.
And you're just around 3 weeks now, right? How has it been?
Great, honestly, After, I mean, for me personally, like we were saying, I mean, I have a decently high pain tolerance. After about 2 weeks, I would say, I wasn't taking acetaminophen every like 8 hours. I was able to go to, you know, maybe just at night or once in the morning and then once at night, and just managing to be fine. And as long as, you know, you just keep all your dishes and stuff on the counter so that you don't have to go above, you know, 90 degrees with your arm, you're fine. I mean, I was fine.
And how do you feel you look and feel actually as well?
So much better. Just even the day of waking up and getting the, you know, band taken off and just seeing all the bandages and stuff, I was like, oh, I'm already flatter than I was prior to the surgery with no bandages on. And it was such a relief, like a crazy relief. It was just great.
Good. Well, right now, you're still in the healing phase. Your scars have really healed. They're healing well. They're coming along. So really, once we get over that phase, then we'll be sending you to occupational therapy to get your arms and everything back to normal as quickly as possible. And I'm hoping that you'll have more confidence to wear the clothing you want to wear now, because we live in sunny California.
We do, It'd be nice to just, you know, hang out at the beach with like a sunshirt on.
And looking back now, is there anything you have? Would you have advice for like the younger self, or you're young enough as it is?
Well, I mean, either way, I was still pretty young then, but I'm young now. But I guess what I would say is, don't feel ashamed of asking for a second opinion, both before the surgery and also after. If you're not happy with how you look, there will be a doctor that will take you seriously if you spend enough time trying to find them, I guess. And I was lucky in that when I moved down here in, Southern California, there's a plethora to choose from because of, just being in the LA area. But even still, ideally, it would have been nice to get a second opinion prior to just getting them off in the first place, of just like, what could this possibly look like? And do you agree with, the other doctor's perspective of whatever they told me? So.
Well, thank you so much for sharing your journey. It's just so enlightening because, first of all, you're much younger than a lot of patients, and you're not, a cancer patient. So a lot of people get mastectomy from cancer, but that's not everyone. But at the end of the day, it's the same things apply. You don't want to look, untidy, deformed, asymmetric, all of those. And I think the other thing is people listening to what you want. Before the surgery, and waking up and not having the surprises that you went through. Well, thank you again.
Of course, thank you.
Aesthetic fat closure is not just about removing the tissue, doing the mastectomy, and closing things without reconstruction. It's about intention, symmetry, and honoring the patient's wishes, and really listening to what the patient's expecting when they wake up and what they have to live with the rest of their lives. If you're thinking of getting a mastectomy or a double mastectomy with aesthetic fat closure, do your homework. And if the first surgeon you see doesn't make sense or isn't on the same page as you, go and get a second opinion. My name is Dr. Wai-Yee. I'm a board-certified plastic surgeon. I specialize in breast reconstruction, breast aesthetic surgery, and cosmetic surgery. I have 2 practices in Arcadia and Pasadena here in Southern California. If you find these videos to be helpful, please hit like and subscribe. And look at some of our other videos that are on this channel sharing other patient journeys.